Before we do any examination, we go through a series of questions about the complaint, its location, its progression, any associated symptoms, and what makes it worse and what makes it better. We also ask questions about past medical history, any current medication, any previous investigations or treatments, and also some general lifestyle questions like nutrition or sleep. It's important to us to have an overview of the general lifestyle and habits of a patient in order to understand better the cause of some of the symptoms, in order to find the most tailored treatment for each individual and also the best management plan for that specific patient. It's obviously great to feel better after a session, but it's equally important to make sure that each patient understands the do's and don'ts to prevent that problem from happening again. As we know, prevention is better than cure. During examination, we ask patients to follow a series of movements, and using our hands, we are able to gather some information on how the body is moving and functioning. The diagnosis and the treatment is always fully discussed with the patient, and unless we need to refer for further investigations, we always do some treatments on the day of your first consultation. The treatment is tailored to each patient. We always adapt our techniques depending on how chronic or acute the complaint is, the age of the patient, if there is any medical conditions, or if the patient is pregnant. We use a variety of techniques such as articulation, soft tissue work, cranial treatment, manipulation, such as high velocity thrust techniques, which are techniques that can produce a clicking sound. Those techniques are used to gap joints, to improve the mobility and therefore restore movement. We don't use those techniques with every patient, and we always discuss the full treatment with each patient before we use them. We do have alternative techniques that we can use if we don't think it's suitable for us to use them, or if the patient is not comfortable with them. After a treatment, we normally give some advice or some exercises to help alongside treatment. This can be some advice to do with nutrition, sleep, posture, even looking at the type of shoes that each patient is wearing. And we also give some exercises to do at home, which are nice and simple in order to help in between treatments.